Well, alright. Where to start, right? So here I am. It is February 25th, 2022. And this whole thing started about 4 years ago. And if you go back and watch some of my old YouTube videos, and I'll bring a few of them up, you can actually see the spot on my face starting to develop. And the trick of it was that I would get it to heal up and it would go away. Then it would come back and then I'd get to heal up and it'd go away. Well, I had been doing a lot of jiu-jitsu at that time, and I had suffered an injury on my face right there. It was from a gi rub, somebody's jiu-jitsu gi, nice and sweaty, and it rubbed across my face really hard, and it gave me like this real deep rug burn. So in my mind, I was just fighting some kind of a chronic infection. And then it went on for a few weeks, and then a few months, and then about 4 years I was dealing with this thing. And after, I would say, at a certain point, and it's a weird, funny thing that happens, because I'm the world's worst about giving everybody else advice. But after a while, in the back of my mind, I knew that it was cancer, but I just didn't want to accept it. I wanted to fight it on my own terms, and I just kept, I would get the thing to heal up and it would go away, and I'd be like, alright, finally it's over, and then it would come back. And then finally I finally, after a few years, broke down and went to the doctor, and sure enough, of course, immediately it's obvious that it was skin cancer. So I went to a dermatologist. She's really good. She's really funny and quirky and all that stuff. And she set me down within 5 minutes. You know, she was pretty much telling me exactly what it was. I actually had some spots on this side of my face that she was able to take care of right there in the office, with a little liquid nitrogen. She got those good, but that was nothing compared to what was going on this side of my face. What I was diagnosed with was a basal cell carcinoma, which, in her words, if you're going to get cancer, that's the one to get, because they can remove it and you can be done with it. Now, had I not waited, and had I caught it back when, or not caught it, if I had went and had it treated back when it was just a small spot, probably would have been at the most a couple stitches and a small scar on my face. But because I waited so long, and I fought it so long, it ended up being a pretty major surgery. Now, I'm going to show you some of the footage and the pictures of my Mohs surgery and the results of my reconstructive surgery. So if you're squeamish about that kind of stuff, this is probably as far in the video as you want to go. Now by the time I got my appointment for the Mohs surgery, in most cases, it's done outpatient in the office, and it's usually a 1-day visit, and you're done with the whole thing. So I get down to the place, and as you can see from some of this first picture here, the spot was at this time pretty big, and what had been happening was the spot on the outside of my face that was healing and going away and then coming back. That's just the tip of the iceberg, because that's just the spot where my skin was showing, where it was ulcered through the skin, but all the rest of the cancer was growing pretty rapidly underneath my skin. Now, Mohs surgery is 99% effective, but they got to remove all of the skin cells with cancer, and they did. And I ended up having 2 rounds. The first set, or the first incision, was pretty big. I mean, it was good size. And then unfortunately, he had to come back and dig out some more, and it ended up being right about a silver dollar sized hole that was left in my face. Now the nurse down there, I gotta give her a shout out. Her name was Kim. She was really, really good. She probably gave me 40 lidocaine shots to get my face numb for this thing, and she kept trying to compliment on how I look like the lead singer of Metallica, James Hetfield, which is a stretch to me, but if that was a compliment, I'll take it, because she really helped keep my mind off of things, and she was really, really good. The whole experience with the Mohs surgery was not as bad as it sounds, but speaking of sounds, you can feel them pull on your face, and you can hear the sounds of the flesh being cut loose from your face, and that, for me, that was kind of the worst part. You can smell the blood in the air, of course, but so they got all that out, and they cauterized everything, and then sent me across the hall to see the plastic surgeon. Now, typically, like I said, most cases, the plastic surgeon will close you up, that day, and you'll go home and start the healing process right then and there. But unfortunately, my defect, as they call it, the hole in my face was too big. I had really 2 options there. The first option was to get a skin graft, which I was really opposed to. I did not want to get a skin graft, especially on my face, because it just, I'm not a vain person. I don't care about the scars or anything, but I've never seen a skin graft on somebody's face that didn't just immediately draw like attention. Like, a scar is a scar, but if you got a skin graft, it kind of really draws everybody's attention to it. And some people have to have skin grafts. I mean, you got to do what you got to do. It's not about vanity at a certain point. But I really did not want to get a skin graft. And the other reason I didn't want to get a skin graft is because essentially you end up with 2 wounds to heal instead of just 1. Now the other option I had was what they call a skin flap rotation, which is what I ended up doing. It's basically where they cut a huge portion of your face loose. They rotate the skin flap over to cover up the defect or the hole. Then they stitch it back down. Now, the reason I couldn't do it in that office that day was because it's a big operation, and the doctor said that there was no way that he could do it there with what he had without hurting me pretty bad. And with me hurting and flinching around and stuff, it really lowered the chances of a good outcome for it. So we talked about it and decided that I would come back 1 week later, and they would actually put me under anesthesia, and he would do the reconstructive surgery on an operating table with me out. And so that's what we did. Now, I ended up having this reconstructive surgery at the UAMS in Little Rock, and awesome hospital, awesome staff. It's one of the leading hospitals in the country. Did a really good job. I was super nervous. I had never been put under anesthesia before in my life. I'm turning 50 years old next month, so I was really nervous about that part. And I've said it a couple times, but my older brother Jerry, he's really been amazing for me the last couple of weeks, driving me back and forth, and especially on this trip, because of all things, we had to have an ice storm hit right in exactly the area that we had to drive through. So I get the operation. I get in the back room, and everybody's running late because of the ice storm, and I'm already tense and nervous, and I want to get out of there because I know the storm's coming in. But I'm also, scared to death about what they're about to do to my face. So eventually they came in, and they get me all set up. I'm a big baby when it comes to IVs, so the nurse was really good. I believe her name was Lee. She actually numbed up the back of my hand for me to put the IV in, so I wouldn't pass out like a big baby. But she was awesome. She did a good job. Never even felt it. And so the doctors come and talk to me for a second, and then the anesthesia lady comes in, and she says, I'm gonna start giving you the drugs to relax you and stuff. And I kind of remember them wheeling me back a little bit after that, but then I was out. Like that, I don't remember. It was just, there was no countdown, nothing like that. I was just out, and then I woke up. So I woke up, and like I said, I've never been under anesthesia my whole life, and I guess I was really struggling, with everybody, because I was super confused about where I was at. And my face was pretty tight and swollen up. I couldn't see out of my right eye because it's still, as you can see, it's still pretty swollen. This is my third day, and still pretty fresh. So I'm still gonna have swelling for a few days. So, but they get me awake, and I realize where I'm at, and I there's no, because all the rooms are filled up with, other things. There's no real room or anything. I'm just in this bed, and then they bring this little curtain around me, and I'm still dazed from the drugs, and I've got to try to dress myself, take the hospital gown off, and I'm trying to get dressed and falling all over the place. I'm super weak, and I finally get dressed. They give me a couple pain pills to take home with me because they know it's going to be a long trip. And then my brother picks me up outside and we start heading home. Now, the drive home from Little Rock to where I live is usually an hour and a half, maybe 2 hours if traffic's bad. And this took us 4.5 hours to get home. And just wrecks all over the place. Like, it is amazing that we made it home. Kudos goes to Jerry for his driving. He's lived up north a few times. He lived in Colorado and Wyoming and all that good stuff, so he knows how to drive in this. But it was just solid ice. And we finally made it home. And, I took my pills and I went to bed. Now, when I woke up the next morning, surely my face was sore. I mean, my face was sore and tight and swollen up and all that. But the worst part really was something I'd not known about or been told about or was looking forward to was the drugs that they use to intubate you, like, because they had to put a breathing tube down my throat. And, I've never had a breathing tube either, so my throat's a little sore. But to do that, they give you this drug that completely just, muscle relaxes to the extreme, and but you have this super body ache, like you have had the most intense workout of your whole life, and every single muscle in your body is killing you. It's like the worst workout you've ever had, the aftermath of that. And that is what my entire body has felt like. I'm a little better today, but I still feel like I've been beat up by King Kong, and then got in a car wreck after that. That's what my body feels like. Laughing, coughing, eating, the muscles in my face, the muscles in my ribs, and my arms are killing me. Like, I've worked out a lot in my life, but I've never had muscle soreness like this. Just getting in and out of the bed has been quite the ordeal. And then there's my face, of course. Now, you can see from the pictures and videos I'm showing you is they basically cut from right here at the bottom of my earlobe, went all the way around down by my eye, made a little triangle, and then come back down my, I don't know what you would call that, like your smile line there. And somehow, some way, they got that to rotate up to cover that hole up. Now, it looks a little weird right now because it's swollen, it's tight. My lip is tight. My face surely is tight, and it's numb in some places. And the other weird thing is like this that's up here used to be down here. So when I touch this, it feels like I'm touching here, if that makes any sense to you. Like, this part of my face has been here for 50 years now. It's up here. So it will take my brain a little bit to adjust. And now here we are. And I've got a few more weeks of healing. I'm going to have to take some time off of work. It's such a big incision that I can't risk messing this thing up. I don't know how many stitches it is, but it sure looks like there's a few hundred in there. I will do what I'm supposed to do, take care of this thing so that I can heal up and get back to a normal life. But here's the bottom line, and here's really why I'm making this video. So if you see a spot on your face, just go get it checked out. Even if the doctor takes care of it right then and there and you end up with a couple stitches, it's far better than waiting like I did until it's a massive ordeal. Don't hesitate. If there's a spot anywhere on your face, your skin, your back, your hands, your arms, anywhere, just go get it checked out. If you get it checked out early, it's a much less intrusive procedure. The longer you wait, the more chances are that you could get really sick from this. Now, I did have basal cell carcinoma, which is this is the easiest one, and you can see what I've gone through to get rid of this. This is the easiest one. So don't wait till it's something worse than this. Now, with the danger of any of these kind of cancers is they could spread and get into, vital tissue, and so that's why I couldn't just let it go. The tumor that was on my face wasn't painful. It was pretty much numb, and it was just an open sore that I was hiding from the world because for whatever reason I just couldn't bring myself to admit that I had cancer. But now, for the time being, I'm cancer free, and I've paid the price to be cancer free. And again, this is one of the easiest kinds of cancer to treat, and you can see that even this is no fun. So don't wait, don't hesitate. If there's something that's not right on your skin, get it checked out and get it taken care of early. That's the lesson of this. Now, I've made a few motivational videos in the past, and if you know me, I like to give a lot of advice, and some people have accused me of being wise, and it's not that. Wisdom is just being willing to learn from your mistakes, and I feel like this experience has made me a little wiser. It never should have came to this point, and if I can help even one person make that decision earlier, I'll have done my job with this. So listen to your doctors. Put some sunscreen on. Wear a hat. If you see a spot on your body, get it checked out fast. In a few weeks, I will give you an update on how this scar is healing and how the swelling is going. But until then, y'all take care. I love you, and I will see you around.